Bring in Philip Catney now, who's in Madeley in the UK. He's a senior lecturer in politics at Keele University. Really good to have you with us, Philip. We heard a little earlier there from the UK Health Minister, who's really essentially putting the blame for all of these disruptions at the feet of the trade unions. Is that message likely to resonate with the UK public?
Not really. The NHS, only a couple of years ago, British people were out on their doorsteps banging pans, clapping hands for health workers. And so it's a bad look for the government to be in dispute with those very same health workers who were struggling during the pandemic. In real terms, the pay of people in the National Health Service and other parts of the state have reduced significantly since 2010. The government is defending itself by saying that the pay level of 4% was agreed by a independent peer review body. The difficulty the government has is that it ignored the peer review body's recommendations over the last decade when they were recommending 1-2% increases in line with inflation. And now they've found that the average pay of a nurse is around 8% below where it was in 2010. And for more experienced staff, it's up to 20 or over 20% reduction in real terms. So the government has a real problem here in selling this narrative that health workers are some radical group who are there trying to hold the country hostage. These are the people who were heroes during the pandemic, and the government is not exactly held in such high esteem by the general public.
But what about the government's argument that the UK economy is currently in bad shape? It's battling a cost of living crisis, a sharp increase in inflation. The Prime Minister says giving in to these pay rises will only make inflation worse for everybody. Is that message also likely to be understood by the public?
Well, there's an affordability issue in terms of the government's finances, which were not helped by its own mini budget a couple of months ago. But there is a problem as well. If they want to talk about inflationary pressures, people in the private sector are receiving inflation or near inflation level pay increases. So this is widening the gap between public and private sector incomes. So the government, back in the 1970s, British governments used to have things like pay policies, try and rein back inflationary pay awards in the public and in the private sectors. So they're not doing that in a sense. They're trying to hold back public pay, which has already been stagnating for a period of time. So they have to. One thing they could do is try and promise longer term structured deals. Say, we can't afford it this year. We promise you that between now and 3 years' time, we might be able to bridge the gap when the finances are better. But the government is not doing that. It's just digging in, saying no. I suspect that the very high levels that the nursing union, for example, have asked for, it's already pretty well been spoken that people in the country, nurses, expect that they'll probably be met, or they would like to be met halfway, that they don't expect to get 19%, but they won't accept 4%. So the government has to do something, because this is a battle which it's probably not going to win, because the public currently are behind the medical staff on this occasion.
Okay, Philip Catney, we will have to leave it there, but great to get your thoughts on this industrial action. Thank you.